In Newfoundland and Labrador, we are fortunate to have abundant sources of good quality water to utilize for drinking water. Many drinking water supplies are from pristine, remote areas where there is little or no activity within the watershed. Despite the near pristine condition of many of our water sources, water used for drinking must still be disinfected to ensure the health and safety of consumers. Newfoundland and Labrador utilizes a multi-barrier strategic action plan to ensure the safety of drinking water for consumers. This action plan was adopted in 2001 after the Walkerton, Ontario E. coli outbreak in 2000 that resulted in the deaths of 7 people and sickened thousands. The multi-barrier approach is considered to be the most effective method of managing drinking water systems and has been implemented by other jurisdictions throughout Canada. Drinking water treatment is one of the 3 components of the first barrier in the multi-barrier approach. Along with source water protection and water distribution, drinking water treatment is considered to be the first line of defense to ensure the provision of clean and safe drinking water to the residents of Newfoundland and Labrador. Drinking water treatment can include many different processes and technologies to enhance the quality of the water for consumers throughout the province. Common to all drinking water treatment systems is disinfection. Disinfection is the most critical aspect of water treatment in that it eliminates potentially harmful microorganisms and prevents waterborne diseases. In most water sources in Newfoundland and Labrador, microorganisms such as bacteria, viruses, or protozoa are naturally occurring but can be the result of water contamination. These microorganisms can make people sick with both short-term illness and long-term diseases. To reduce this potential health risk, disinfection is required to kill or deactivate disease-causing microorganisms like rotavirus, Campylobacter, Giardia, and E. coli, and to protect the water from contamination by microorganisms as it moves through the water distribution system. There are a number of methods that can be used to disinfect drinking water to make it safe. Chlorine is the most common disinfectant used because it is safe, affordable, works well, and is relatively easy to use. Prior to the use of disinfection in drinking water systems, waterborne diseases such as cholera and typhoid fever reached epidemic levels, which resulted in millions of deaths around the globe. In most developed countries today, waterborne diseases rarely exist due to the use of chlorine or other forms of drinking water disinfection. For more than a century, Canada has greatly improved the safety of its drinking water supplies by the addition of chlorine to drinking water systems. To this day, chlorine remains the most commonly used drinking water disinfectant and the disinfectant for which we have the most scientific information. In Newfoundland and Labrador, chlorine has been used in some communities for over 60 years. The use of chlorination in our province was initiated to treat our water to prevent what used to be commonly referred to as summer complaint or bad belly. Cases of diarrhea and other gastrointestinal illnesses were commonplace due to the microorganisms in drinking water. The addition of chlorine to our drinking water has greatly reduced the risk of such waterborne illness. It has been more than 15 years since there was a documented waterborne disease outbreak in Newfoundland and Labrador. This is because of adequate drinking water disinfection, increased awareness, and the government's commitment to provide safe drinking water. In Newfoundland and Labrador, there are 486 drinking water disinfection systems. Chlorination accounts for 98% of disinfection systems, while the remaining 2% include ultraviolet light, or UV, ozone, and chloramines. Of the chlorination systems, 67% use sodium hypochlorite added as a liquid, 31% use gas chlorination, and 2% use calcium hypochlorite mixed as a powder with water to form a solution. No matter what type of chlorine is used, it must be added to the drinking water at a particular dosage to inactivate or kill harmful microorganisms and provide a chlorine residual throughout the entire water distribution system. The community's water system operators have been trained and do routine testing of chlorine levels in your drinking water on a daily basis. Operators can adjust the chlorine levels to ensure adequate protection and strive to maintain residuals at optimum levels for your community. Provincial officials with Service NL and the Department of Municipal Affairs and Environment also check chlorine levels when they collect regular drinking water quality samples. Newfoundland and Labrador has standards in place for the amount of chlorine required to disinfect drinking water and protect consumers from microbial contaminants. In order to maintain adequate disinfection throughout the entire distribution system, a detectable free chlorine residual must be maintained in all areas of the distribution system. The maximum free chlorine residual at the first consumer or anywhere in the distribution system should not exceed 4 milligrams per liter. Above this level, there are no adverse health effects according to Health Canada and the World Health Organization. However, the odor and taste would not be palatable to consumers. At times, people may be able to detect chlorine in the water and are reluctant to drink chlorinated water due to the smell or taste. In most cases, the smell and taste is normal and within recommended standard levels to ensure the safety of your drinking water. Drinking water systems that are chlorinated are tested regularly by provincial officials with Service NL. Your drinking water is tested for the presence of indicator bacteria, specifically total coliforms and E. coli. Their absence, along with a sufficient chlorine residual, indicates that the disinfection system is working effectively and killing or inactivating any microorganisms that could be harmful to consumers. If the taste and odor of chlorinated water bothers you, consider removing the chlorine from your drinking water using a jug filter or point-of-use filter. A jug filter is a container that has a filter the water flows through that removes the taste and odor of chlorine on the water. The jug can be placed in the fridge to be cooled. A point-of-use filter is installed either on the existing kitchen tap or under the sink with a separate tap that can be used for drinking water. Similar to the jug, the water flows through the filter to remove the chlorine taste and odor. When selecting either type of filter, ensure the filter is NSF 42, Aesthetics Effects certified for chlorine removal. This certification ensures the filter is specifically designed to remove the taste and odor of chlorine in the water. Ensure to follow the directions on the filtration unit and change the filter as recommended. Disinfection byproducts have emerged as a potential health risk of disinfection, and levels in public drinking water systems are regularly monitored by the province. It is important to note that current scientific data shows that the benefits of chlorinating drinking water are much greater than any health risks from disinfection byproducts. If you are concerned about potential disinfection byproducts, you should consider a filtration system that is NSF 53, Health Effects certified for THM removal. Again, ensure to follow the directions on the filtration unit and change the filter as recommended. It should be noted as well that the drinking water disinfectants other than chlorine, like UV, ozone, and chloramines, all have potential risks which have not been as extensively studied as those of chlorine. Given that chlorine is relatively cheap and cost-effective, and safer compared to the other disinfectants, it will remain the disinfectant of choice for most communities in Newfoundland and Labrador for the foreseeable future. For more information, visit the Department of Municipal Affairs and Environment's webpage. There's lots of information available on drinking water quality, chlorination, and your community's drinking water quality. If you have any questions about drinking water safety, please do not hesitate to contact the Department of Municipal Affairs and Environment, Service NL, or the Regional Health Authority nearest you.